It's clear that we have an issue of different stakeholders, but also power and accountability. How do we collaborate with foundations that in a country like Sudan or Kenya would have a lot of impact?
On the private sector, I think there is of course, a very mixed bag here of big private multilateral companies that are really harmful for people's health across the world, producing things that are really not good for people's health, especially bad food, junk food. But I think the private sector is unavoidable. We need the private sector to produce drugs, vaccines, food, infrastructure, energy, etc. So the question is how we can work with the private sector, both to regulate them, but also to incentivize them to produce things that are good for people's health. And I think there are tendency today where people are beginning to see that private sector, corporate sector is not just the bad guys that are only basically getting the money and we're getting nothing out of that and they're just harmful. I don't think we can have that attitude to the private sector. We need to find a way also of engaging and understanding in terms of what is creating a private corporate sector that is actually producing things that are good for people's health